Of Medics. Hope everybody is well. It's your favourite person, Tanisha, and joined with me is...
Hi everyone, Dr. Emma.
It's our Dr. Emma. So, this week, it's just a one-on-one chat with me and Dr. Emma talking about the life of a dermatologist. So, we're just going to jump straight into it. Dr. Emma, introduce yourself to everybody.
Hi everyone, my name's Emma. I'm working as a dermatology registrar in Southwest London. And I co-founded the House of Medics, and I do a few other things as well.
Lovely. Okay, so my first question is, what is a dermatologist? Just for those who don't know, what is an actual dermatologist?
Okay, it's actually good you ask this question, because a dermatologist is a medical doctor that looks after medical conditions of the skin. So a lot of people think that I tell people what cream to put on their face to avoid aging, or yeah, like I get a lot of questions about, what should I put on my face? And I may know those things, but that's not actually my job. Yeah. My job is to look after medical conditions, which can be very severe. But the day-to-day stuff I see all the time is severe eczema, severe psoriasis, like blistering skin conditions, vitiligo, stuff like that. So yeah, medical skin problems.
Okay, so you're going to have to break things down. So you said V something and you said psoriasis. So what are those things? Just for the people who don't know, and I don't know either. So I know something to do with the skin.
Yeah, so all skin stuff. So I'm sure a lot of people will have eczema. So eczema is an inflammatory skin condition. So psoriasis is another example
of eczema.
Of an inflammatory skin condition, but a different one. I should have said the majority of my work is skin cancer. That's what we do a lot of stuff with. Vitiligo is what Michael Jackson had that caused parts of his skin to turn white. And then he says he depigmented everything. But yeah.
Do you think he did? Is that even possible to do?
It's possible, yeah.
Is it?
Yeah,
How would you depigment your skin?
There are ways to do it. There are basic compounds you can do it.
Like creams and stuff?
Because he had the money, he probably just did it. Most people, we don't advise that that's what you do, but he probably just paid for it.
Okay, awesome. So let's talk about when you was younger to how you are now. Did you always want to be in the field of medicine? Did you know it was skin, it was dermatology, that's something you wanted to do? Did you study this? That take me from when you was maybe in secondary school into college?
Yeah, so yeah, I decided I wanted to do medicine really early on. I'm one of those people that's got pictures of themselves dressed up as a doctor when they were a kid. Not sure why I wanted to do medicine, to be honest.
Yeah.
A lot of people say like, "Oh, your parents probably forced you to do it." That's not the case at all.
You just always wanted.
I've just always wanted to do it. Yeah, that's just what I've
that.
always been drawn to do. I don't have any doctors in my family. I just made up my mind and went for it. So I just made sure that for me that meant I had to be very driven. Meant that like throughout secondary school, obviously I had to be doing well in school. And I just stayed on that trajectory, made sure I was doing well in maths and science.
Okay, I've got a question.
Yeah.
So when you was in school and people said, okay, so what are you studying to become? Your answer straight away was, I want to become a doctor.
Yeah,
so you just knew.
Yeah.
Did you have any teachers say to you, are you sure you don't want to do anything like athletics or anything like that? Did people try and kind of deter you to not do that
definitely
stuff?
not athletics, because I was useless at athletics. But in terms of teachers that knew me, they were pretty like encouraging in terms of they knew that I could do well. So they were like they were fine with me wanting to do whatever I wanted to do. But I come from a very small town. Like there's no university in my town, so I don't know anybody else that went to my school that eventually went on to do medicine. But like I think they probably they didn't necessarily think very large. So it was kind of like, okay, well, if that's what Emma wants to do, whatever, maybe she can, maybe she can't. It's not like I had a lot of people pushing me.
Yeah.
I remember one time when the careers counsellor, so it's like an external careers counsellor, came to the school and said, what do you want to be? And I said, I want to be a doctor. And he was like, well, that's a bit hard. Why don't you do nursing instead?
Oh, God.
So I was thinking, you can go home and say that's your kids. You're not saying that to me. So, luckily, I just have I have encouraging parents. My parents would always tell me, whatever you want to do, you can do it. Always encourage me. So it's fine. My brothers as well. I've got 3 older brothers.
So you're the only female in your family?
Yeah.
Siblings, right? Yeah.
Yeah, I'm the only girl. So they always encourage me a lot. So I've always felt like if that's what I want to do, there's no reason why I can't do it.
Are they all proud of you, like your brothers and your parents and stuff? I can imagine. Okay, awesome. So talk to me through the stages. So obviously primary school, you done the maths and English and normal stuff. Did you do like college or A-levels, and what did you study then?
So I did A-levels, I did, I think it's different now, but at the time we did AS and then you did A-levels, so you would do like 3 subjects and then you drop 1. You do 5 subjects and then you drop 2.
5 subjects?
Yeah, that's how it used to be.
I just done performing arts, so I wouldn't know.
That's why you're the host, isn't it?
True, very true. Yeah, 5 subjects, that's mad.
Yeah,
sorry.
I think it's different now. When I talk to college students, it's different. But at the time, you would do 5 subjects at what we call AS level. Okay. And then when you go into your second year of college, A2, you would drop 2 of them and then take 3 to do 4 A levels. Okay. So I did maths, further maths, it was like double maths, biology, chemistry, and...
Wait, you're good at maths?
Yeah, I love maths.
Oh.
Yeah. Actually.
Oh, how are you now?
Yeah. Do you need to know maths?
Yeah, I was doing my masters.
I didn't know you were doing your masters.
No, I was doing my masters.
I
suffered.
Yeah, that's between you and yourself.
So you done double maths?
Yeah.
Wow, interesting to know.
Yeah, I really enjoyed maths.
So did you do science?
Yeah, biology, chemistry.
Okay, awesome. So then you went on to university, and what was the subject called that you studied?
Medicine.
Just medicine. Okay, so after university, did you have any kind of like internships or anything like that?
Yeah, so every medical school is a bit different, but the majority will do like a few years of what we call preclinical, which is pretty much lectures, sitting in a lecture theatre, learning, how the body works, etc. And then within your medical school degree, you do a lot of actually going into placements, going into hospitals, GP practices, etc., doing different things. So a lot of people were like, oh, medicine is so long. Actually, it's not, because you're only in a lecture theatre for 2 years, and then the rest of the time you're in hospitals getting hands-on experience.
So did you enjoy that experience?
Yeah, I loved it.
You did? Okay, yeah. That's the importance of kind of like wanting to know what you want to do, because obviously you can see that you have a passion for it. Okay. Yeah. So talk to us about college. Sorry, carry on. I cut you off.
No, that's fine. Yeah. So it's during that time. That's really, to be honest, where you differentiate a lot of people. A lot of people think they want to be doctors, but then when they actually go into hospitals, they're like, oh, this is long. It's not for me.
Did I loved it. Drop out of the course?
Not a lot. Most people will finish. Yeah. Or you can like leave after 3rd year, because then you have a bachelor's degree and you can do something else. But the vast majority of people do finish, but then some people just leave medicine to do something else, because once you have the degree, it opens a lot of doors for you to do other stuff. But that preclinical to clinical thing is definitely a differentiator as to whether you actually, or do you actually want to be a doctor, or you just thought it would be cool
to do. Got you. Okay, so you went on from being like a medical doctor to a specialist now in dermatology. I remember the transition. I was very proud. I was like, I was a specialist. I was very, very proud. So, speak to the viewers about kind of that transition. I think you had to study for a certain amount of years, and then you could choose a specific thing, wasn't it?
Yeah.
And talk to us about that.
Okay. So yeah, this is actually good. So if there's anyone in medical school now, a lot of people don't actually know this. A lot of people go into medical school and then they're just like working, and they don't know what's going to happen when they finish. So when you finish med school, it's almost automatic, to be honest. You almost automatically become a foundation year 1 doctor. And before you finish your final year, you will apply to like various areas within the country, and you'll be ranked. Like all the doctors in the whole country are ranked. And then let's say if you come high up, then you'll get your first choice. So let's say you want to be in South London, and if you rank highly, you'll get South London and happy days. But if you rank low, then you might, be sent somewhere like Scotland.
Okay.
If you don't want to go to Scotland, obviously some people want to go to Scotland. So that's what happens there. So you'll do 2 years of what we call foundation training, foundation year 1 and foundation year 2. Once you finish that, again, it's changed slightly, but I'm of the cohort where we had core medical training. So basically, at the end of foundation year 2, you need to decide whether you want to be a medic, a surgeon, a GP, a pediatrician, an obstetrician. Basically, you decide your specialty. So I chose medicine.
Sorry to be annoying, can I ask what the differences are between... To me, I know that GP means general practitioner, right? Yeah, general practitioner, but that sounds like a children's doctor.
No, so GPs are like the ones you see, your first port of call. You know when people say my doctor, usually they mean their
like
GP.
A community doctor.
Yeah, exactly, a community doctor. Usually they mean their GP, the one that they see when they have an issue, the one that probably they've been seeing throughout most of their life. That's your GP, general practitioner, exactly as you said.
Okay.
And then there are so many different specialties. So like, for example, obs and gynae, they're the people that look after pregnant women, or they look after like the lady parts of a woman. Pediatrics look after children.
Peds.
Yeah, you've got A&E doctors, you've got surgeons, and then within surgery there's so many different types. General surgeons, bone surgeons, like facial surgeons, so many different specialties. Yeah.
So before you picked dermatology, did you do research into it, or did you just know, okay, I think I'm going to go with skin?
Yeah.
Because when you picked it, I was shocked. I was like, oh, dermatology. I didn't know that was something that you proper liked. So, yeah, what was the process?
So I think the main thing is when you pick, you need to have had some experience in it. So I've always thought I might like it. So when I was in foundation year, I was really lucky that I actually did a dermatology job, which is quite rare. There aren't many. So I did 4 months of dermatology in the same hospital that I'm working in now.
Yeah.
And I really enjoyed it.
What was like a typical day? When you
it's quite nice when you do it as a foundation doctor, because there's no stress. Like you're what they call supernumerary. So you see patients like 1 or 2, maybe you'll see like 3, and then you get to like follow people and do some stuff. And it's really nice when you do it as a when you're that junior. But I just loved it. I love the kind of people that dermatologists are. I love the variety. So you see adults, you see kids, you see cancer, you do some surgery as well, which I really enjoy now. I just love the variety of it. So then I got it in my head then that I probably wanted to do dermatology. And then what I didn't actually mention is in between foundation training and core medical training, I took a year out to become a teacher. So I went back to Imperial to teach. Yeah.
I didn't know this.
You didn't know?
No. That's why you speak so well in front of bare people.
True, actually, yeah, because I was basically teaching every day. Yeah.
Wow.
So I was teaching medical students.
That's very interesting to know. So how many on like a random day would you have in like one class?
So it depends. So it's a really cool job. I would definitely recommend it if anyone likes teaching. But you're basically called a teaching fellow. And you do, so sometimes you do small groups, sometimes you'll take students to see a patient, and there might only be 4 students. Then sometimes you might give a lecture in front of 100 students.
So you do lectures?
Yeah.
Wow, that's Emma.
Yeah, so I did that for a year, which was really fun. And the good part about that job is I was teaching dermatology as well. So I was teaching general medicine, and then I specifically had an interest in dermatology. So again, it was just more dermatology experience. And then I did another dermatology job when I was a core medical trainee. And this is really, really rare. Most people don't actually get dermatology jobs. So I was really lucky to get those jobs. So for me, it was kind of like, I've done a lot of dermatology experience. I'm pretty sure this is what I want to go into. And even then, when I was applying, I applied for dermatology and cancer medicine because I still wasn't sure. But then in the end, I chose dermatology.
Yeah. Okay, awesome. So just so the viewers can kind of get more of a flavour as to what you're like. Because I know you're Dr. Emma, but I don't just want to talk about medicine. What are your hobbies? What do you like doing? I know you cook sometimes and stuff. I know you like to go out. Like, what else do you like doing? Tell the viewers a bit more about you.
I don't like questions like that. I do a lot of stuff. Yeah, I cook. I don't particularly like cooking, but I cook. I like music. I don't really like TV. I started watching The Crown yesterday.
I've warned you about that.
Yeah, I know. But
what episode are you on now?
2.
You're finished. That thing is amazing,
proper.
Guys. Okay, it's amazing. I'm glad you're watching that. Actually.
Yeah, no, but
it's really good.
I don't know how much of my life I can give to that thing.
No,
but yeah, I don't watch much TV. I used to watch a lot of TV when I was a kid, and then my parents put me on restrictions. So I think
because you watch too much.
Yeah, so they put me on an hour a day. Wow. So now I think it's just out of my system. But yeah, I like music more than TV. I don't like going out as much as I used to. I'm more of a homebody.
I think that's everyone now. It's because of the lockdown.
Yeah, I know, but you know, a lot of people are stressed out. They're like, oh, I want to get out. I'm like, I can stay in my house.
I'm fine now if I go for a walk. You know.
Yeah,
I'm fine. Yeah, it's not good because I think it's making my social skills go like this. So when I'm with people, I'm like, yeah. So you know. But okay, cool. So another question. I'm gonna kind of like push you out there a bit more. So some things that you guys might not know, Dr. Emma has been featured in magazines. She is always speaking on some sort of lecture or some event. She's also been around Central London. There's been posters of her as well. So as a young black lady, black woman even in the UK, what do you think is the importance of kind of pushing yourself out there? Because again, like you said, you've taught. You've kind of done the years studying, you kind of knew what you wanted to do, but you were your own kind of motivator, if that makes sense. What do you think is the importance of kind of pushing yourself to do medicine?
Yes, I think it's really, really important. I think it's a good question because the reason I say that is when, so that story I told you of, I said I wanted to do medicine and they told me not to. Do you know how many people I've spoken to and they're like, yeah, me too. Happens all the time.
Do that?
I don't know. I just think,
who told them to become a teacher?
I'm even wondering, like, if you don't feel motivated in yourself, go home and talk to your kids like that. Don't talk to other people's kids telling them not to do stuff. Yeah. So I think it's so important. Even my colleague, like literally the other dermatology read, she's Kurdish, we were talking about it the other day. She was like, yeah, same. They told me that I couldn't do medicine and she's doing very well. So I think it's really important because, like I said, I was lucky. I've always had the kind of structure around me where my family are just like, no, do it. What do you want to do? Yeah. What do you need? Do it. My brother always used to say to me, well, the person that did it before was born naked the same way that you are, so go ahead and do it. But a lot of people don't have that. Or some people are a bit more insecure, or some people, I think the other thing as well is if you haven't always done well in school, you just get into your head, I can't do it. There's, why would I even think about being a doctor? I'm not a straight A student. But that's not the case at all. And a lot of unis even make allowance for that. There are courses, you can get into medicine without having studied science. Like King's do a course like that.
What about not studying maths? Can you get into it?
Yeah.
There is hope for me then.
Yeah, John, it's not Tanisha.
I mean...
but yeah, I think it's really, really important. A lot of people say, just like, oh, Emma, you're out there a lot, but it's kind of like, because I know that people need to see me out there
to get to where you are.
People need to see like another person. I didn't go to any special school. Like I said, I don't have doctors in my family. Just someone that decided I wanted to be a doctor and did it. And we need to stop, like, people need to stop looking at it like, wow, she's a doctor. Like, no, let it just be very normal that we achieve and we get to these heights. So yeah, very, very passionate about putting myself out there and making sure that people see it's possible, because I'm just a normal person.
No, I love that. Okay, so tell the viewers about a typical day in the life of a specialist dermatologist.
Okay. So
actually, tell us a normal day and a surgery day, because when Dr. M does her surgery day, she comes home, she's like, guys, no surgery today.
It's true.
So tell us the two differences.
It's true. Okay, so yeah, it's really busy. A lot of it, I think it's quite dependent on where you work, but I work in a really, really big, really busy hospital. So that's the first thing I'll say. A lot of people think that once you get into dermatology, your life's going to be chilling, but that's not the case at all. My hours are really long. So usually I'll get to work a bit early. My clinic starts at 9. I'll try to get to work by 8:30, just to quickly look through my list, respond to any emails. And then my clinic will be from 9 to about 12:30. And I'll usually have...
What's clinic?
Clinic is just me in a room, patients come and see me with their problems.
Okay, so one at a time?
One at a time. And usually the first half of the clinic will be new patients, so people who've been referred by their GP with a problem.
Do you like clinic?
It's good. Clinic is good because it gets you thinking, but it's mentally exhausting. Like from when you work on the wards, this is something I didn't realise at all. Like when you work on the wards, you just sort of do your ward work. You go around, you see your patients, and then you do your work afterwards. But clinic, you're seeing a new person every 15 minutes, and your mind like has to always be sharp and on point. So it's really, really tiring. Really hard work, but I love it because I'm always thinking like you're basically problem solving every day. Some
sort of solution.
People are presenting to you a problem, and it's you're trying to find the way to solve it. And often it's not. It's not black and white. It's not like you have disease X, which is treated with treatment Y. It's like, okay, you have disease X, but let's say you work full time, so you can't be applying cream 5 times a day, or you're allergic to this or this and that. So it makes you really sharp. So I really enjoy it. But like I said, it's a lot. It's 12 patients within 3 hours. They get like 15 minutes each. So yeah, you have to be like on it, and really you have to listen well. You have to be a good communicator. You have to have conversations. It's a lot.
Wow.
Yeah, so that's that. So that'll be the morning clinic, and then I have lunch, which to be honest is usually me eating in front of my computer, answering more emails or sorting stuff out. And then either I'll have another clinic from 1:30 till 5, or I'll have some admin time, which is where I can like catch up on things for patients, call some patients I need to call, chase some investigations, blah blah blah.
Okay. I literally just had a question in my head, but it literally just ran out.
Oh, you want to know about the surgery days?
Yes.
Surgery days.
That's good.
So surgery days. So I just love. I didn't even like surgery as a whole when I was in medical school, but I love the derm surgery. I just find it really satisfying. Someone will come in with a cancer and you cut it out. It's just great. Like within an hour or even 30 minutes, you cut out the person's cancer.
No, it doesn't. No. When you say someone comes in with a cancer, they'll come in with like a mole on their skin, and you like just cut it off. Yeah, so you don't put numbing cream or anything on it.
So we give it anaesthetic. So let's say you've got cancer that's like this, right? I'll give you injection anaesthetic. So
you inject it?
Yeah.
The cancer?
Check the skin.
Oh, there you go. Sorry. You inject the area to make it numb, right?
Yeah, to make it numb. Right. So then you won't feel the rest. So then you can like look away.
Do they actually feel it though?
No, what they say is that they feel like prodding and pushing, but they don't feel anything sharp.
Because the skin's obviously moving from...
Yeah, exactly, because I'm doing stuff. So let's say the cancer's this big, but I don't just cut out the cancer, I need to put a margin around it to make sure that I've got the whole cancer.
The whole area,
So I cut it out, and then the best part is when you put it together, which is the most satisfying part.
What do you mean?
Because you have to stitch it together and make sure that you have a nice, neat scar.
Oh, so you cut it out and then put the skin
and then
together.
Put the skin back together.
So you stitch as well?
Yeah.
Oh, wow.
Well, I could just leave it open.
Fair enough. Yeah. No, I thought maybe you put like a band-aid.
No, stitch them together. Okay. And you leave people the nice scar. And then,
so that's anywhere in the body.
Like I don't do faces, just because I'm not experienced enough yet. So later on, but yeah, pretty much do anywhere.
Okay, cool. So what are the pros and cons would you say about a dermatologist? Or anything in medicine? Yeah,
medicine as a whole. Someone asked me this yesterday actually, so it's fresh in my mind. As a whole, you sacrifice a lot. So in terms of, I didn't finish uni until I was 24. Obviously, most people finish when they're 21.
So how many years did you study for?
6. Yeah, but like I said, it's not long because I only did 2 years of sitting in a lecture room. The rest of the time I was out and about, seeing patients, doing what I want to do.
Yeah.
That's fun. So yeah, you sacrifice a lot. And when you compare your life to your non-medic friends, like, let's say like one of your friends is having a wedding, you can't go because you're on call. To other people, that's just foreign. It's like, but why are you working on a Saturday? It's like, no, I'm working. I'm going to be in the hospital. So you do miss like significant events. It's hard to like move stuff around. I remember for my wedding, I wanted 3 weeks off. So I had to swap so many shifts that when I came back, I literally worked for like 3 weeks straight and I was a zombie. So it's not like you can just take time off whenever you want. Yeah, it's quite demanding. You have to be flexible. You don't earn as much. So for example, those of us that do medicine are obviously academically able, so you could have probably gone into banking and be earning twice as much. So I think because of TV, because of most of the TV we watch is American, people think that doctors earn a lot of money, but in the UK we don't earn a lot of money. We just earn I always say, don't think about going into medicine for the money, because you'll be very disappointed.
You have to really love.
You have to love what you want to do, exactly, and actually love. It's a vocation. It's not a job. Like, you have to really be called for it. And then the pros are that I meet so many different types of people. I'm always interested. I'm always learning. I'm a people person. I love people. So I just love that. As soon as you say you're a doctor, they just open up to you. Like,
it's like they're happy. They feel safe.
Literally,
They feel safe around you.
So people just open up and they just talk to you. And I enjoy that. I enjoy meeting different types of people.
I think I'm going to start saying that, you know.
What? That you're a doctor?
I think I'm going to start saying that. I feel like that's a great icebreaker. Yeah, guys, I'm a doctor.
And then
I can just ask you any questions that they might ask me. Or I can just tell them that I can't explain things outside of the workplace. So I'll just...
let me know if that works.
Yeah, I'll let you know.
Let me know how you get on with that one. But yeah, it's great. I would never do anything else.
Okay, but you did give me... Wait, did you give me pros and cons? You did give me pros and cons. Okay, so I'm going to ask you a couple more questions, and I'm going to let you speak about the House of Medics as well. What do you think the evolution of the medical industry is? And tell me how you think it's changed so far as well. How long have you been in the medical field for as a whole?
So I went to uni in 2009, and then I qualified 2015. So I've been a doctor for 5 years, almost 6 years. It's changed a lot. Even so, you know, the things that I've mentioned to you about stuff that's changed, like the training and stuff, those things change, but probably in practice, they're not very different. Like what I was mentioning is that when I did it, it was called core medical training. Now it's called internal medical training. Really, it's the same sort of thing. So that's not necessarily what I mean when I say that things have changed. But in terms of the expectations and the communication with doctors, I would say, for example, back in the day, it was very much doctor has an answer, patient just does what the doctor says. But now it's much more like two-way communication. So I always say to my patients, what do you want to do? Here are the options. And I think
so. You actually ask them.
100%. First, there's no point prescribing treatment for someone without checking if that's what they want, because they just won't do it. They'll come back and see you in 6 months' time. They haven't done it, and you've wasted everyone's time. And secondly, I find it a much more rewarding thing to have a conversation with a patient, like, okay, but what's important to you? Some people have things and they're like, you in your head, you think, oh, this is really bad. And they're like, nah, don't want to treat it. And it's like, okay, if it's not dangerous, you don't have to. What is going to make that person happy? So having those kinds of conversations, I love. I think also in terms of diversity within medicine, you know, it wasn't that long ago that if your parents weren't a doctor, you couldn't be a doctor. And I know it's still the case in a lot of countries. Like, I know, for example, in Ghana, it's quite hard to become a doctor if you don't come from a family of doctors. And that was very much the case here, which is not the case anymore. You know, if you're academically able and you've got the right characteristics and qualities, you can become a doctor, which is great. And then I think in terms of practice, we're going to see a lot more technology in medicine.
The world is turning into tech.
100%, yeah. So medicine can't be caught behind. Even in terms of COVID, like I do a lot of my consultations over the phone now, which we weren't doing at all.
Yeah. Do you think that's better or?
I think it works for some patients. There are some patients who, you know, it's a lot of hassle for them to come to hospital. So to have the option of a telephone consultation is good. I think it's good that it's an option. But to be honest, there's a lot of things, because it's dermatology, a lot of things I need to see and feel for myself. So I'm looking forward to when, you know, the lockdown's completely eased and most of my patients will be face to face.
Okay, so at the moment they've kind of been on the phone and describing it. Have you had any like
they send pictures? Yeah, so they send
by email. Okay.
So usually before the appointment, an admin staff member will ask them to send photos. And some do, some don't. So then you have to call them, like, where are the photos, and you have to wait for them to send the photos. It's a lot of faff. And even those that do send photos, you still need to see it, and you need to be like, oh, actually, I need you to come in because I need to see this face to face. Definitely pros and cons.
Okay, cool. So as time is going, we're gonna begin to round up, but I know this is a dreaded topic that everywhere and everyone is talking about. We have to touch on COVID. We have to, and the reason we're gonna touch on it is because you're a dermatologist. But because COVID got so bad, you were then asked to come to the wards. So how did that kind of affect your work? Did it affect your mental health? If so, how did you deal with it? Do you have any advice for anybody else that kind of might be?
So I'll say it's actually, when I was asked to leave dermatology to go work on COVID, it was only for a week. So it was actually fine. because I had actually been on the COVID ward during the first wave for 3 months. So when COVID first came, I wasn't in dermatology yet, I was a general medic. So I was actually one of the first doctors who were on the wards looking after COVID patients. So we learned a lot. We had to be really flexible in that time. And the hardest thing was that it was a new disease, so we literally didn't know how to treat people. We were literally watching people and the oxygen was dropping, so we give them oxygen and then you give the maximum oxygen and then the oxygen is still dropping and then you just have no treatment and you're like, gosh, you don't know what to do. So people were dying a lot. And we were just learning as we were going, kind of thing. In terms of my mental health, I think I was quite lucky because I have support system around me. Obviously we live in the house, so I could always come home and have people around me. I know there are a lot of people that live with vulnerable people, so they had to then like leave and go and live in hospital accommodation, and they were on their own, which must have been a lot more difficult for them. I think for those who may still be going through this, I think definitely find people that you can speak to. Make sure they're always having time out. Like I always try and leave my work at home. So definitely being able to just go into a space and having left work at home and like being able to put that to the side. So then when I went back second wave, which was, just last month, second wave going back from dermatology, piece of cake, because now we've got treatment. And I was like, wow, this is amazing. We didn't have this last time. Now we know, steroids work. We've got medicines that work. People, like, nobody died on the ward that week that I was on the COVID ward. So it was, it was much better.
Awesome. Okay, cool. So we're going to begin to round up, but just for the viewers and if there's any young people or older people that are going in to study medicine, what advice would you give them?
I think definitely be sure that you want to do medicine. Be sure that you've had some work experience, that you're basically, because the reason I say this is because there are going to be times when you're just like, this is so hard, like I'm studying so much, it's long, my friends are finished. So definitely be sure that you want to do it for the right reasons. In terms of ways to make yourself competitive, just do a lot of work experience, ask a lot of questions, make sure you do well at school, obviously, because it's a must. And just basically ask a lot of questions, get involved in opportunities. You need to bulk up your CV and have things that show that you actually want to do this medicine thing.
Okay, awesome. So guys, just before we round up, if anybody does have any questions that they want to ask Dr. Emma or myself, not sure I'll be of much help, but do send them in just so we can answer them. Dr. Emma, talk to us about the House of Medics. And obviously it's not just Dr. Emma, it's also Dr. Aaliyah, who's a senior pharmacist, and Mary as well. I always get this wrong. I always say radiologist.
No, she's a radiographer.
She's a radiographer. That's what she is. She's a senior radiographer as well. And we've also got Dr. Abraham, who one day you guys will meet. one day very soon. He's behind the camera, guys, so you'll meet him very soon. He's also a doctor as well. So I know we offer mentorship and other things like that. So just tell the viewers a little bit more about what the House of Medics are, what we stand for, and what the point of it actually is.
Sweet, yeah. So House of Medics is just a community, basically. And the reason we started is because a lot of us are members of various medical societies, which I won't name. And then I was just doing informal market research. I was asking people why are you part of the society? And most of them were like, I don't know, they just take my money every month or they take my money every year. And maybe I can I can attend a conference or I can watch an online lecture. But nobody knows people in these societies that are for them. Do you get what I mean? Like people that are their advocates. And I feel like when you read the history of these things, when they were made in the 1500s or the 1800s, that's what they were meant to be. They were meant to be communities, support networks. And I feel like as things have grown, that has been sort of taken away from these societies. So it's really just to bring that back, just to be like, look, we are people, normal people, like look at me, look at her, look at all this amazing stuff that's happening, and just make sure that we have a community. So there are people who don't have any medic friends, so when they have a hard day at work, they don't even have someone to speak to. They can't even come home and vent because their friends are looking at them like, what are you talking about? So it's really just about community, supporting people, and then alongside that, the mentorship. So like I mentioned, I don't want any young person to feel like they can't do what they want to do because maybe they don't feel like they're smart enough or whatever. So it's just like to inspire people, encourage people, make sure that people know that whatever they feel that they want to do, we can help them in terms of doing that, and also bring opportunities for people, like direct people towards the right resources, because it's really a maze. There's so much out there, directing people to things that are beneficial for them. So that's what the House of Medics is about. It's going to grow a lot more over the next few months. There's also the branch in Ghana, which is where we do the charity work that we do. So yeah, it's a community basically.
Love it. Okay, awesome. Thank you. So I've got one question. So the question is, can Dr. Emma tell us what other departments there are in medicine? Because we always hear about doctors and nurses.
Okay, yeah, so many. That's a really good question as well. So many. So we've got pharmacists, like we said, pharmacists, radiographers, as we have in the house. You've got occupational therapists, physiotherapists.
Wait, what's occupational therapists?
So occupational therapists are people that help people optimize their living arrangements, for example. So let's say like an older person who can't walk as well as they used to.
Yeah.
An occupational therapist would say, you need to have this frame at home, this walking stick.
The stuff that they get on the wall.
Yeah, stair lifts, all that stuff. So occupational therapists will do the assessments and help people do that.
Interesting.
Yeah, so many. You've got physiotherapists who will help people, get back on their feet after an injury, or people who have been unwell for a long time. Obviously, if you've been in hospital, you lose a lot of muscle mass because you're in bed. They'll like build back up your strength. You've got physician associates, which is kind of like a more new kind of role, but they're basically people who can become highly specialized within a field and pretty much act as doctors without going through like a full traditional medical degree. You've got dietitians, people that tell people the right types of food to eat, optimize their nutrition. There's literally speech and language therapists, people that help people speak, make sure that they can enunciate their words, make sure that their swallow is safe. There's literally so many departments in the hospital. That's the other thing I say, like when people say they want to be a doctor, I'm like, are you sure? Have you checked all these other things? Because maybe you think, like people say all the time, oh, I want to do medicine because I love like movement and exercise and stuff. I'm like, but have you looked into physio?
That sounds like sports therapy or something.
But I'm like, you do realize you'd have to do like 10 years of general medicine before you could even do any sports therapy. Have you considered physiotherapy?
Yeah, so there's a lot
so
to
much.
it.
Yeah, you need to look at everything as a whole. The medical field is massive.
Awesome. Okay, I'm going to take this last question. It says, how did you come up with the House of Medics?
Cool. So it's kind of, well, I suppose it started because we came together. So me, obviously my husband, Aaliyah, initially were the first members. We came together, we're quite close. And then Aaliyah and I work in the same place. We ended up saying, why don't we just live together? And then like, obviously you moved in the house, Mary's moved in. And it's kind of like, and then I've got a lot of my mentees as well who would be around the house, and I would sort of like be talking to them all the time, and it was just like, well, it's just the house of medics. It is what it is. Like, this is what we do. We're, in terms of medics coming together, supporting each other, this is what it is. So it kind of wasn't like a premeditated thing to like form this thing. It really came naturally. Like, this is actually what we're doing. We're supporting each other. We're mentoring people. And we've got like a lot of affiliates, like other organizations that we work with as well that we are part of. For example, one of our members founded Health in the City, which is more about education of students. One of our members runs something called All Births, which is about maternity health. So much. So yeah, just all sort of came together as like an umbrella thing for all these different things that we're doing.
Okay, awesome. Somebody said, Felicia?
That's my mum.
Yeah, look. She said, that's my girl. Hi, Auntie. Okay, awesome. So tell everybody where they can find you.
So you can find me on Instagram, Dr. Emma, with an extra 3 A's. So Dr. Emma, AAA. You can find me obviously on YouTube with the House of Medics. On Twitter, same Dr. Emma, AAA. What else? LinkedIn.
Yeah, you're on LinkedIn as well.
LinkedIn.
And you're on Clubhouse as well.
And I'm on Clubhouse, but I haven't really started using it very much.
But you can still follow.
You can follow me for now.
Okay, awesome. So I'm going to go through our social media. Yes, I am reading it off my phone because we have a lot and I usually get it wrong. So our website is wearehouseofmedics.org.
No,
it is.
It's not
houseofmedics.org. Let me just correct this from now. Instagram is We Are House of Medics, same as YouTube and LinkedIn. Again, on Clubhouse, follow Dr. Emma and you'll see that she's following Dr. Aaliyah and Dr. Mary and Dr. Abe as well. I hope is on Clubhouse. And also on Twitter and TikTok, it is We Are House of Medics. My social media handles are Tanisha_X. Thank you guys so much for joining us today. Again, if you have any more questions, feel free to DM us on Instagram or Twitter or any of the other social media platforms. You can also message Dr. Emma as well. Thank you so much for joining, guys, and we'll see you in a couple of weeks.
Bye, everyone.
Bye.